John and Amanda Miller believe their child's life was saved for two reasons. A pharmaceutical company, in this case Rare Disease Therapeutics, was willing to take the risk of developing a drug for a small patient population. And NORD, working with the company to assure patient access to the drug. When Evan Miller was 12 weeks old, he experienced a medical crisis. Doctors at Children's Hospital of Philadelphia diagnosed the problem, Tyrosinemia, and gave Evan's parents the good news that there was a treatment. But the family had no way to pay for the drug.
I went on the internet and I found another child with tyrosinemia that had a website set up. I immediately called the phone number, and I actually got a hold of his mother. And I asked her for advice. I said, "You're the only person in the world right now, other than me, that I know that knows about tyrosinemia. What do I do? And this is my situation. I can't take him home. I can't do anything." This is about a month after we'd been in the hospital. She said, "Contact NORD."
The Miller story illustrates why we are celebrating the 30th anniversary of the Orphan Drug Act and of NORD. Much has been written recently about the high level of interest in rare diseases and orphan products. Drug approvals in 2012 hit a 16-year high. 39 new drugs were approved, and almost one-third of them were orphans. This brings hope to the 30 million Americans with rare diseases, and it reflects the coming to fruition of a process set in motion more than 30 years ago.
What happened was, my son couldn't get this drug because the company was not going to develop it for Tourette syndrome. And a mother from California had called me because her son had terrible Tourette syndrome, and he was able to get this drug from Canada. But he had a friend going to Canada, and they asked the friend to bring back the drug. Customs Department confiscated it at the airport. And since he couldn't get the drug, the mother called me and said, "What should I do?" And I said, "Call your congressman." By the way, who is your congressman? And she said, "Henry Waxman." And Henry Waxman is one of the most powerful people in Congress on issues that have to do with health. And so she called her congressman. He said, "I think this subject is important enough to hold a hearing." And he asked me, and he asked this young man from California, and he asked Dr. Van Wert, who was dealing with myoclonus, and a young woman who had myoclonus, to come down there and testify. This was June of 1980. And we testified. I was working at the Tourette Syndrome Association at that time, and somebody said, "Abby, there's a man on the phone, and he says his name is Maurice Klugman, and he's the brother of Jack Klugman." And I said, "Yeah, this is really going to be fun." Well, it turned out he was Maurice Klugman, and he was a producer of The Quincy Show. And he said, "I think that my brother should make a show about this topic, because this is not just entertainment. He should be using that show to teach people about health problems that arise, and health policy things that are important." And so, yes, he did a program about Tourette syndrome and orphan drugs. And at the end of the program, there was a notice that even though the story was fictional, the orphan drug problem is real. And if you'd like to help, write to the show. Well, he got thousands and thousands and thousands of letters. He didn't even open them up. He just put them in big sacks, and he sent them all to me.
The founders of NORD quickly realized that their best chance for success was to find their common ground and work together. That strategy has served the community well. With its 200 member organizations, dedicated partners at FDA and NIH, and innovative companies willing to take on the challenge of developing therapies for small patient populations, NORD is focused on advancing the dream of the Orphan Drug Act. Since 1983, it has played a key role in public policies such as the Rare Diseases Act of 2002, FDA Safety and Innovation Act of 2012, and Social Security Compassionate Allowances Program. NORD supports the efforts of companies to address unmet medical needs and engage in a whole new level of commitment to the patient community. It promotes awareness of rare diseases among clinicians, and NORD research grants, funded mostly by patients and patient organizations, give families hope that one day they, too, may have a treatment. NORD encourages best practices and supports learning from each other, and it has formal affiliations with Eurordis and the Japan Patients Association to support global collaboration. In this 30th anniversary year, NORD and the entire rare disease community are celebrating progress to date. But we're also renewing our commitment to the rare disease patients and families who don't yet have a treatment, or need a diagnosis, or need help to access care. Mary Caruso, whose daughters Sam and Alex were diagnosed several years ago with the rare disease known as Friedreich's ataxia, has learned firsthand the value of connection and the power of hope in the rare disease community.
We have that thread that sews us together that even, like our family, extended family doesn't understand. So you are connected to these people and everyone's working so hard to raise funds. And then the researchers that come and make it a point to meet the families that get so personally involved, it is what keeps hope in your heart. And I absolutely have no doubt in my mind that will lead to a treatment very soon.
Hey, Evan, say thank you, NORD.
Thank you, NORD.